there,
Right.
but I lecture there. I teach there.
Wow.
Yeah.
Awesome. Lovely. I've seen them all and I was very impressed actually. I was trying to get in touch with you for the longest time, but it was so hard to get in, not
Sorry.
just your office also. So I was just telling the girls outside, I said, well, my daughter, by the time she tried to get in touch, it got weeks and weeks and weeks to reach out, and that's how I would book my flight and come. But
And where exactly is this place in Uttar Pradesh?
this is in Noida, Delhi.
Oh, Delhi only.
Delhi. Yeah.
Okay, right. Fine. So the nose, basically the tip.
I want it very sharp and
Sure, but you don't have any breathing issues.
Oh no, thank God.
What about your health issues?
I'm fit and fine, thank God.
Nothing, that's nice. No known medical issues. What about COVID?
Oh, COVID, I had COVID. Yes.
When was that?
This was in 2020.
But when?
Approximately sometime in March.
Okay. And you're vaccinated?
I am, Pfizer.
And booster done then?
Yes.
RT-PCR done recently and you traveled?
Yes.
Cool. So that medical side is fine. Fine.
Actually,
Have you had any fillers in the nose?
Not nose, but I did have Botox. And then I had fillers on my cheeks, and a little bit at the lower eye level.
Okay, when was that?
5 years back.
Okay, that's long enough. Okay, right. Okay.
Another one day. I got my upper eyelid, but I'm not satisfied with it, so I wanted it.
Slight improvement there as well. I can see the scar.
Yeah, because I saw my eyes before I could not open because it was so droopy, because my mom has droopy eyes. So, so it's really
You were saying something about the eyebrow as well. What exactly do you want me to do? Do you want me to get it darker, or you want me to improve the height, or do a lift?
Yeah, a little bit lift, not much, because I don't like the skeletons, when they have that. I don't like that. I just slightly, very natural.
Okay.
And what else? I'm looking for my lip actually.
What about the lip?
A little bit plumpier lip,
More?
Me. This is my natural.
Yeah.
That's in fashion, right, Doctor? No?
Yeah, that is in fashion.
No,
but-
and then you also see these lines here, right?
Yeah.
So that if it is a little fuller, then it will look more
That will
youthful,
also
right?
be fine. Okay, that's cool. Just look like this. And you have a
Cut
yeah,
that I felt.
correct. So anything you want to fix that, or that remains the same?
No, you can fix.
Okay. So this chin is also pretty broad, and the cut is like making the chin split. So you don't mind if that gets a little bit more pointier and projected?
No worries, I'm in your hands, so you.
I just want to know what on you.
I mean, you do the best you have. Put it all on me.
Okay, and then right. Now, I think one thing that will really make a huge improvement is your nose job.
Absolutely.
It's going to make a
Yes.
big difference, right? Number one. And there's not enough support here. So what's basically happening is, it's like the tent, doesn't have support, so
Right.
therefore it's collapsed. So I'll definitely have to give it some support.
Right.
But we can also make a sharper tip. You have a thicker skin, but still will be able to improve it phenomenally, first thing. The second thing that actually looks a little not too nice is this groove, which is very, very prominent.
Yeah, very
so
prominent.
we'll reduce that
Yeah,
significantly.
this I want.
Yeah. So
This
along with the
whole
nose,
part, everything.
the whole nose, this area will all get tightened, and this groove will get lessened. The tip will get projected. It will get narrow. That's the nose. That you can expect like very, very good improvement. Okay. Now the next thing that we can do is a lower eyelid blepharoplasty, because this will take care of this much part, and then this much part we'll have to work like this, so that you want to have a look in the mirror.
Yeah,
Otherwise,
of course.
don't think you can see what I'm trying to show you. So Now, when we do the nose, what all will happen is, so it'll get tightened here, get narrow. This will come up a lot, like this, and this will go down. And this groove will really get less because all of this gets pulled out and stretched. And I'm going to tuck it in from here as well. So this part will get firmer. Not exactly so much, but it will by moving it like this. You can see how the skin gets tighter. Now for this, we'll have to do this. So we'll remove a little bit of the skin that's excess. You see this?
Yeah, more useful.
Yeah, and then we'll also remove the pad so that gets useful. That part. This is the nose. For the chin, now there is a thing which is like a clefting, which is not so nice, and plus this height and this thing. So we'll be able to get it forwards a little bit more pointy, so that this goes in and this comes forward and this gets stretched, which means from this line to here, this will all get stretched. Not like this, but better than this, because we're going to bring it out. Remember, we're bringing it out so it stretches the skin and it gives a youthful look. That's one point. So, but if you want me to address here, I cannot do what I do for someone younger, like a bone work. It won't look well for you. For you, I'll have to do a tightening from there, like a facelift, a small one, which can come till here, and then from here the bony part will take over. Okay? Now, so that takes care of this much, this. So it leaves basically your upper lip. Now, I'm not a fan of this lip lift where you do this way and
No.
look that. Yeah, it looks like that. It looks a little youthful because the show is more. But for that, I have to do this. That's the lip lift, which I'm saying because if this is not going to be doing the elasticity has actually lengthened the lip. All right. So to reduce the lip, we need to do something like this so it looks better. There are two issues with this. One, I may not be able to do it along with the nose job. Because for the nose, I'm going to go from here, I'm going to go from there.
Correct, all over.
All I can't. So that's one thing.
Okay.
And so we'll have to wait for this thing to heal. And secondly, when I come from the nose, remember from the nose I told you I'll work here. So then from the lip I have to work here. So it's all like too close by. So only the upper lip, we can probably leave it. You can try fillers, or if you want me to do something, or this we can do also if you want. But it doesn't look too bad. It's just, I mean, I don't think it's a big concern at all.
That's because I have Botox abhi.
Correct. तो रहने दो ना.
So
because एक बार बोटॉक्स लग गया ना तो उसी टाइम सर्जरी करना उचित नहीं है. जो मुझे नहीं मालूम होगा ना कितना टाइटन करना. अभी ऑलरेडी वो the nerve is not allowing the muscles to work. That's what I'm saying. उसको छोड़ देते हैं. ये लिप को भी छोड़ देते हैं. लोअर लिप आपका जो है unfortunately will get little thinner. Little bit lower lip, not thicker. See.
Okay, so we can do fillers.
You can do fillers later on.
You'll do it for me?
No, we won't be doing it. You can get it done elsewhere. That's a simple daycare procedure. Even the lip thing I'm saying, it's a daycare procedure. So if you do desire, बाद में आराम से एक दिन में हो जाएगा ये.
Okay, come back here.
Yeah, this is easy. Okay. So this much we'll be able to do. Definitely you'll need.
How about my neck?
So I'm not doing a lot of procedures on the neck. In terms of cosmetic things. So maybe not do anything from me.
Okay, you don't want to do anything.
Yeah.
Why is that? But it is so.
Because one, when I do this, the neck improves. This improves the entire area this much. Because we're pushing everything forward. And two, just working on the neck, it's not my real core expertise.
Got it.
So I don't want to do that. That's the reason. Two reasons.
Understand.
This is going to improve anyways.
Okay.
And we're already doing a lot. Now what we're doing is probably going to take us 5-6 hours easy.
Okay.
Yeah, because the nose itself takes well over 2.5 hours, 3, and chin and this, and then the breath. That's going to take a while. It's already like a lot on the plate.
Okay.
And these are my core skill sets.
Okay.
Which I can deliver you much high results.
Okay, maybe next time.
ठीक है वो if you think
every year I come by, so every
no,
year
you'll not need
every year I come to my daughter and then so So, of course, I can make a trip here too. Like, maybe next year I'll look into that then.
Sure.
My lip and whatever.
Just the upper lip is something which I think I'll be able to improve, but we'll have to wait because we need this all things to settle in, and then we can improve that.
For sure.
And then by the time maybe if the Botox effect wears off, then we can consider doing something more permanent, which you will not require Botox later on.
Right. Right.
These are the two things.
Okay.
So let me make a note of these first up. Then
That's my scalpel?
no, no, I'm going to put yours. This is the scan for her daughter. Preeti, right? Yeah, I'm just seeing Preeti's. Wow, you have, okay, yeah, this is you.
So what was that wall over?
The war was because you have 32 teeth and all the teeth are in good shape.
Yeah, thank God.
That's rare.
I'm like, why?
That's rare.
Really?
Yeah, it's very rare. Maybe 1 in 100 or even less.
Wow.
Yeah. No jokes. Because I keep seeing scan, I keep assessing so many things, It's a very common thing people have. 32 teeth that are functional.
Yeah.
No.
I think I'm very blessed in that way.
Dentally blessed.
Thank God.
Yeah, that's good. So
Very,
yeah, your
very,
septum also is not very strong.
Right.
Definitely,
So
we'll
that's
have
what
to
going to-
take rib.
Yeah.
And your chin looks like it'll definitely make a huge improvement because on the scan, if you look, it just looks very broad and it doesn't look feminine at all. It's very broad in this width.
Right.
So we should be able to give you a very good result there as well.
And what is the recovery time on all of that? My son is getting married actually. He's my elder son. I don't like to say that word in-law.
Acha, daughter to be or daughter already?
Just
ठीक है, okay. So my wife calls my parents Appa Amma only. So it's like father. But whatever you call, blood is thicker than water, right? That's a fact I've come to learn, come to realize. But anyways, now you looking at, we do all of this, couple of weeks, 10 days at least minimum.
No worry.
Because you know what, now I mentioned like we're going to do a lot of these. So now the bony procedures will take time. For youngsters, it takes about 7 to 10 days. Or for people who are above 40, it takes a little longer to heal. So I would expect it to take 10 days.
No worry.
After surgery, 10 days.
After surgery and then even by it's on March 7th, right? 7th March. The wedding.
7th March is the
You're
wedding.
most welcome, please. If you come to Delhi.
Thank you. So 7th March is a lot of time. I think by that time you should be able to recover quite well. In the sense that others will not know that you had any surgery, but you yourself will know you're not feeling exactly normal everywhere. You might feel something happening in the nose. Usually the last thing that's going to heal up would be your nose. For the example, this would heal up very quickly. Even the facelift would heal up reasonably quickly. This thing would heal up maybe in little next after the nose or just before the nose, in that order. So, but yeah, so you still have a month and a week. 1 month you should be able to recover very well, that no one else will ever know you've had anything done. But still you will not feel how you feel as comfortable with your face as you're feeling right now. Correct. नहीं वो सब तो हो जाएगा. नहीं. Talking will be fine.
अच्छा.
What's going to happen with your talking?
अच्छा, तब ठीक है.
Talking will be fine, eating will be absolutely fine.
Okay.
Eating, I'll have restrictions only for a few days, talking for a few hours.
Okay.
That's nothing going to happen with talking and eating.
I'm not a big talker anyway, so that's okay.
No, but there's going to be no issues with talking and
Right,
eating.
right.
The issues will be, you might feel some heaviness, you will feel something that your nose is a little bit hard,
Okay.
not tingling,
That's okay.
but it may not feel like how we feel, you know. Some
Right.
people have some things, they tell us things like this,
Right.
that they don't feel it like normal.
Very true.
But that kind of thing you'd expect.
Okay.
But nobody would, I mean, like no one else should be able to find out or even guess about if anything is wrong.
Sounds great. Can we also know about the price now?
So the pricing will be done by my executive. He will, I've written down in detail.
Okay.
So for example, the nose, the tip, the nasolabial fold, the chin, the genioplasty, the jaw sculpting, the mini facelifts and blepharoplasty, and I've also mentioned 2 procedures for later on, just that I remember.
What is that?
The lip lift and the eyebrow. I've just written.
No, my neck.
Yeah, for the neck,
You forgot, but
I probably.
That time you'll be pro. I have to, you know. You're a pro already in things which I've already seen, but yeah.
Thank you for that. I take that as a compliment. So we'll. All right. The next thing is you talk to my executive, and then you let me know when you would want this to be scheduled.
Right.
We could schedule earliest on Monday, even though we have appointments, but we could schedule it on Monday if you want.
Okay. Sounds
But you'll have to let us know.
for sure.
Okay?
Will do.
Any other doubts or concerns?
No doubt. If I was doubting, I would not be here. So.
Doubts, I mean, in terms of your procedure or healing or.
No, not really.
Okay.
You know, I think so mentally, if you are prepared, then everything is good to go, right? It's all mind over matter, right? So, yeah.
Nice, I like patients like you.
Yeah.
No, because really, people who are like that at the end are more satisfied, are more happy, are more grateful,
Right.
and that's why we are here for, you know.
Yes,
At the end of it, you're doing this for being happier,
Right, absolutely.
and this mindset is it's really nice.
That's good. That's all.
No, really, it is very much real fact. I'm saying.
Yeah, thank you.
From having dealt with patients for so many years, their prior expectations and doubts
Right.
and queries and concerns actually can be predicted quite well to their satisfaction level post surgery.
Very true.
Because you know, very often you will have a happy surgeon and a not so happy patient.
Yeah.
I'd rather be not so happy, but you be more happy at the end of it. A happy patient is more important than a happy surgeon.
Yeah, that inspires the doctor also to do a
Correct.
better, job and everything. They look really,
Correct, absolutely.
It's like the energy.
Yeah, I
which
totally
we give
agree.
one another, I think. So that's,
Absolutely, I like your energy too. So that's good. So we can, you can talk with my guy, this executive, and then after that we can take it forward. If you have any more queries, you can ask him and I can
No worries.
sort it out.
Thank you very much for your time and everything.
You're welcome. Pleasure.
Pleasure is mine too.
You're welcome.